answers. So next speaker is Expanding Eye Care Practice by Dr. ARUN SINGHVI. Is he here? He's not. Oh, that saves us some time. The Managing Finances in Group Practice by Dr. Love, Coach Gave. Is that right, Spider?
Yeah. Yes,
Coach
sir.
Gave. Now you can take your time. No, only 8 minutes. We'll, please be precise so that, no, take 8 minutes because there are a lot of questions to be answered.
Sure. Can we have the slide on the screen, please?
That all your questions are, noted. Whoever has, and we get 30 seconds to ask a question and 30 seconds to give you the answer. Then we can cover all the questions.
Thank you so much, and it is a great honor to be speaking in this annual symposium of AIOS. And my topic is probably, as Dr. Debashish Bhattacharya told, probably the most controversial, and there will be a lot of questions. So I'll just share some background of where we come from. All of us have different mentors at different levels, and these are some of my mentors. One of my mentor is not mentioned here is Dr. Debashish Bhattacharya himself. We have always been approaching him. Dr. Pramod Bende is there. So, and initial years, I would say that even Dr. Devi Shetty was there. So we are a doctor-owned group practice, and as all models have their advantages, the advantages of our model is less capital expenditure and best utilization of space, proportionately best earning potential for doctors, get the best of talent, better referrals because all solution is available under one roof. Academically, we are very active and we have a good number of publications among ourselves, and patients are taken care of when doctors go on leave. Risks. Biggest risk, I would say, is the risk of disintegration, and we have seen many practices disintegrate. In this, the solo practitioners don't have to bother about this, and I have been closely following many group practices, and what I have observed that generally disintegration occurs 17 to 20 years after the practice started. And our practice, three of us started with it, and we are in our partnership, we are into our 18th year. So that is making me uncomfortable. So solution is select team with utmost caution. The leader needs to sacrifice most. Everyone is to be allowed to pursue their own ambitions without hurting the interest of other. Very, very important that legally and ethically we are correct so that no one, even other doctors or other people are not able to point any fingers at us. System has to be fair. One thing we have been very careful about is that system has to be fair and same for owners and non-owners. That is for doctors, I mean. Communication channels have to be open because interpersonal problems come on day-to-day basis, and if we don't sort it out at the bud, it will keep on enlarging. And let go of things. So our first center started 9 years back, and it was a private limited company because it is better structured, and the senior partners allowed the younger ones to run the affairs, and this was a first step for future growth. And next we started last year was the second center by a different brand name, which was called Netralayam, because again, the group of owners were different in this. So just our case study, all of us are almost same culture. We all belong to one organization, which is Shankar Nethralaya. Most of us, 90% of us belong to that. And all of us are first generation ophthalmologists. So none of us had any backup for ourselves. All are self-employed. No consultant is salaried in our model. And professional fees in OT and OPD is shared. We don't charge for cross-consultation. Suppose if I see a patient and that patient goes for a retina checkup, so that retina doctor will not charge for them. And it's as I told, it's a private limited company. ownership is among the doctors and our administrator. There is no outside partner in this. And the ownership partnership was pre-decided. Income is by professional charges of the doctors, dividend from the company, and as the company grows, the valuation of the company. So what we started 9 years back was with just a small investment of 1.5 crores, and that was shared by the partners. We started with 10 consultants, 15 optometrists, 4 consultant rooms, 4 optometrist rooms, 2 operation theaters, and 20 to 30 staff. And the journey now at present day, we are 30,000 square feet, which is 3 times what we started. 20 consultant rooms, which is 5 times what we started, 38 optometrist room, 6 operation theaters. We have 3 optical stores, 2 pharmacy, and the consultants have grown to 40. And we have 7 physicians and anesthetists with us, and the staff strength has also grown almost 10 times, which is more than 200 staff. In our model, just for a better understanding, I'm sharing the figures that we suppose we charge 700 for a patient, 500 goes to the consultant, 200 goes to the center. For all diagnostics, 100% is kept with the center. And for OT charges, we charge the basic is for 8,500, and it has incremental charges also. For higher packages, charges are more, but most of the surgeries the center gets only 8,500. Physician is a full-time employee of the hospital, and anesthetist is on case basis. Concessions, it is consultant's discretion. If the consultant decides 0, then hospital also charges 0. It is for the consultant to decide. Hospital charges for OT reduce only when the consultant charge matches the hospital charge. If we are charging 8,500, if the consultant's professional fee is 8,500, it doesn't reduce. If the consultant professional fee goes below 8,500, then proportionately the hospital charges also again. Next, what I have mentioned, because when I made this presentation earlier, the impression that went was that we are a money minting machine. We are not, because this is what I learned from Dr. Devi Shetty when we started. At our center, no patient leaves our premises due to lack of funds, and every patient is taken care of even if the charge is 0. They are not refused, and that cost is absorbed by the hospital and the doctors, and because we don't get any donations. Human resources, every consultant has about 2 to 5 employees. Hospital has 100 full-time employees, in which high-paying are our administrator, who has been upgraded to CEO now, and physician, and fellows, the trainee doctors, optometrists, and finance people are the mid-level, and lower middle level is the OPD staff, and housekeeping, security at the lowest level. Finances, now we have gone up to gross revenue of almost 25 crore annually, and if you remove doctor remuneration, as you can see, in our model, more than 50% goes to the doctor. In most of the hospital model, I think even in Disha, the doctor's revenue share would be around 20% of the total revenue. So, dividend-wise, from the first center, we have got almost 3 times what we had invested, and the numbers in first year, we saw around 7,700 patients. Now we are 66,000, and around 7,000 surgeries. We started with 845 surgeries. Injections also have grown multiple fold, and we keep on reinvesting into the latest equipments. Presently, except for LASIK and Femto, we are almost full. Profit growth over the years, this is displayed here. It has been a good, decent growth. Last 2 years, we have, due to COVID and very intensive capital expenditure, the last 2 years have not been very profitable. Otherwise, we were doing quite well. So where do we stand 9 years later? Investments we have done, return. Individual practices, whoever were with us 9 years back, the practices have grown multiple fold. Shareholders have got dividend almost 3 times the original investment. The company capital without further investment has increased from what has started with a 10 lakh capital company is now 6 crore capital without any further infusion of money. And we invested further in a new center, which is around 6 crores last year. How do partners gain? Partners have full freedom to do their own new ventures. They have flexibility and mutually acceptable conflict resolution, and everyone has a exit plan. If they want to exit from the company, they can do it whenever they want. Philosophy, it is ownership by doctors. Consultants are our strength. That is why we get good quality consultants. There are no non-medical investors. There is no pressure of EMI or return on investment to investors, and that helps us in being ethically correct. Criticism of this model, it cannot create value for the company. That is a fact. Because in our model, the company cannot grow at a pace in which other models can grow. But when you mean the company, it is for the owner of the company. Here, most of us are owners of the company, so once whatever is being plowed back is with us only. And in our system of wealth creation secures the life of doctors of the hospital, not the owners alone. And individual doctors are financially quite secure within 10 years. And for doctors who are confident of building, it is for doctors who are confident of building their own practice and don't want to get trapped in salary incentive of corporate hospitals.